Yes, sir. Mary Baker Shaw. Mike Dobbins.
Here.
Keith Austin.
Here.
Hurley Buzzard.
Here.
Joe Bird.
Aye.
Julia Coates.
Here.
Sean Crittenden.
Aye.
Joe Deere.
Aye.
Kanan Duncan. Rex Jordan.
Here.
Daryl Legg.
Here.
Wes Snowfire.
Aye.
Dora Petskowski. Mike Shambaugh. E.O. Smith.
Here.
Janice Taylor.
Here.
Victoria Vasquez.
Aye.
We have a quorum.
Thank you, Kelly. You had a chance to look at the minutes? Just a small note in the minutes, Pfizer was misspelled. Other than that, I think you might know. Okay, I had a motion and a second to approve the minutes. All those in favor? Any opposed? Thank you. We're ready for our reports. Claremore Unit, George Vallier. George, are you there?
Yes, I'm here. Can you hear me?
We can.
All right. Good afternoon. Hi. You should have a copy of my report. Outpatient visits are on the rise. After the initial surge of COVID, we've and slowing a lot of the outpatient clinics down. Visits are starting to increase. Revenues are still below what they were last year, so we're still working on that. Still recruiting a surgeon and a hospitalist. To date, we have tested 15,439 patients through our drive-through, with 1,963 of those positive. So far to date, we have given 996 COVID vaccinations, first round, and then we have given 3,875 flu vaccines. If you haven't been up in a while, we have a drive-through clinic up front. We put a structure out in the parking lot where folks can make their appointment and drive through and get tested right out in the parking lot. They don't have to get out of the car. The vaccine is inside the facility, down in the conference room by pharmacy, by the outpatient pharmacy. So things are going well. Today we have 8 COVID positive patients in the hospital. 6 of those are in ICU, but we continue just to plug along day to day. Are there any questions?
Okay, go ahead, Joe.
How many tribes are you actually vaccinating there in Claremore?
We don't even, I haven't broken it down by tribe. I could see if they could do that and report it to you next time.
That would be fine. The reason I ask is I have been asked from various tribes, the Osages, the Delawares, and those people in the Tulsa area, can they go to Claremore and get their vaccination? And I really didn't have an answer. Then the other question, a follow-up to that was, are they giving the Pfizer or the Moderna there at Claremore? And I don't have the answer to that.
Okay, right now, yes, any tribe, any federally recognized tribe that's eligible for service here can come get their vaccine here. And yes, right now that's what we have on hand is Pfizer.
Okay. Thank you, sir. Okay. Thank you, Mr. Chairman.
George, it's Janice. I just wanted to express my appreciation for the way you have handled the vaccine. I have sent several of my constituents over there, and I've gotten nothing but praise for how polite everyone they talked to was. And so I appreciate you taking such good care of my people.
Oh, thank you. Thank you. I'll pass that on.
Yeah, sure.
Yes, Mr. Chair, I echo what Councilor Taylor said with additional thought. I personally am scheduled to have the vaccine tomorrow at Claremore Indian Hospital because it's 55 plus. I have dealt with your staff on the phone, and they were phenomenal. I have many friends and family who have had the great opportunity and service as well. They have done a great job in Claremore taking care of our citizens through this process, and they are really ahead of the curve. I'm really proud of your workers there. Thank you.
Thank you, sir. I'll pass that along. Thank you.
Yes, George, when do you anticipate getting more vaccine?
We get shipments of vaccine every week, sir.
Okay, so you'll get some more this week.
Yes, sir.
What was your initial amount? You said you did 996 shots. What was your initial amount that you got the first time?
That 996 has been stretched out over the last 2 or 3 weeks since we started. I don't have the exact number because we have been like the nation there. We've been a hub for some of the other federal sites and received extra vaccine for them. So I don't know the exact number that we got for us initially.
Okay. And I want, you said you had 8 patients and 6 patients in ICU. And how many ICU units do you have at Claremore?
6.
6? Okay.
Yes.
Okay. All right. Thank you, sir.
Counselor Coates, did you have a question?
Yeah, I do. Thank you. Mr. Valier, to verify, I think I just heard, so you are offering for 55 and older, and you are getting new shipments of vaccine every week. So it's not as though you're running out or anything like that. Is that correct?
That's correct.
Okay. I've had a constituent in Tulsa who's been texting to me several times this morning that they're continuing to call and are just getting a busy signal when they're trying to make an appointment. Do you have any advice about what people can do in that situation?
This morning, we had the phones overloaded and everything dropped. That was kind of unexpected. If they will get back and try again, the appointment number to get the vaccine, if they cannot get through, if they'll call me, I'll go down and get it and have somebody call them back because of problems with the phone system. But I think I was told right after lunch that the phone system had been addressed and we were back to normal calls again. But the overload this morning, being a Monday morning, just overwhelmed it and it completely shut down. We couldn't call in or out for a few hours. My apologies.
Okay, no, that's actually a relief to hear. So thank you very much. I'm glad it's back up. Thank you.
You're welcome.
George, this is Counselor Dobbins again. You said you had
Yes.
6 ICU beds, correct?
Yes. Yes.
What are the plans when you have a 7th patient that needs an ICU bed?
We have sectioned off part of the GMS floor as a COVID unit.
How many total beds do you have?
Well, for COVID folks, sectioned off, we have 12.
Okay. And then in totality, how many beds do you have at Claremore Service Unit? How many total beds?
36.
36. Very good. Okay. Thank you, George.
Oh, you're welcome.
George, I just got a question. It's more out of curiosity, but I heard Captain Watts talking the other day, and you guys are going to do away with the system that you use now. We have Cerner that we got, I don't know, 6, 7 years ago. Do you have any idea what kind of unit you're going to go through Indian Health Service?
No, sir. I haven't been told which one we're going to get. We will. I have no idea. Nobody's mentioned that down at my level yet.
And the reason I say that, I know we had a lot of problems with Cerner when we first got it, so make sure you guys, if you have any input, take a look at that. The RPMS system that you currently use, I'm not really familiar with it, but I am familiar with it somewhat, but it could do a lot more detail requests than what Cerner can do now for the Cherokee Nation, so I do know that. So I guess it is a concern to me that that we get a good system on board through the IHS, because we struggled for a couple of years with the Cerner system here at the Nation. So anyway, I've just FYI for you.
Well, thank you.
Any other questions for George? Thank you, George. Good.
Thank you.
Okay. Okay, the next report is from Dr. Steve Jones, Cherokee Nation Health Services. Dr. Jones, are you there?
Yes, sir, Counselor Dobbins, I am here.
Okay.
So I guess we'll do what we normally do and go through the written report first, unless you have any objections to that.
No, go right ahead.
So as we go through the written report, you can see on the highlights, it talks about a drive-through for WW Hastings on the weekend of Thanksgiving. So this is a little outdated from the standpoint of we've been doing that since that weekend, every weekend through Christmas and New Year's. And that's from 8 to 12 to take some pressure off the urgent care and ER, so that those patients have a way to go through without actually having to go inside the building to the urgent care and ER. It's been very successful in helping to reduce that workload on that group that's working hard every day. So behind that, you'll find a couple of patient compliments, or at least one long compliment there that we thought we would share. I won't let you guys read that on your own. If we go on over to deeper into the report, you can see that the referral approval rate was 97.6% this month. And last time I was asked to see if I could get by Counselor Shambaugh to get a number. So for the month of December, we did 9,480 referrals worked through in the month of December. And keep in mind, there were some holidays in there, so that's a pretty large amount of referrals worked for that group. On back through the report, you can get on back to the testing per clinic for the number of tests ran, and you can see that number kind of fluctuates. You can see which clinics are seeing more through the drive-through than others, and kind of our volume there. So again, this is numbers from a little while ago. I'll update you on my verbal report on current numbers, but the written report has to be turned in such a way that it's always trailing behind on current data. So with that, I'm going to move into my verbal report and give you some highlights. Outside of COVID, our OSU Medical School building is completed. They've got occupancy, and the OSU has moved their students out of our outpatient facility into the building since they have occupancy, and I think today might have been the first day of classes starting in that building. So we're glad to get that completed and get that off of our plate, and get that space available back to us. And we've actually moved our vaccine clinic into that space, so that's been a help. We also received, and I reported this before, that we received ACGME accreditation for our family practice residency. We got approved for 6 residents per year, and we're moving from 4 to 6, is my understanding, this year, because we had a really good class of applicants. So We're going to speed up our process a little bit and move to the 6 residents a little faster than we anticipated, just because we have a really good class of applicants. Gadoogie Clinic is just about completed. We should be moving into the new building there by the complex and starting seeing patients there, or having that available for employees on the 20th, which is Wednesday of next week, is what our operational group has told me. So we'll talk a little bit about COVID. Testing continues. We continue to do testing at all of our facilities, drive-through 8 to 4. We are using the reference lab test, the Abbott rapid test when it's appropriate, and over the holidays, leading up to the holidays, we were using a Binex test. The Binex test was a little quicker to get the result out, and it was a little more labor intensive on the front end, but we wanted to get those results out as quickly as possible in case someone helped them make a decision not to maybe see their loved ones and get anybody that was positive notified as quickly as possible before the holidays. So we've finished that project, and we're back to using our reference lab and rapid tests currently. Most of those folks that we're using for the Binex test, we've had to pull into the vaccine clinics. We're constantly shifting staff from place to place. So again, like I said earlier, our hospital's offering drive-through testing between the hours of 8 and noon on the weekends. So as long as the weather permits. We don't have a building over there. We were using the awning and we're using our tents for that area. So if weather gets too bad, we'll have to stop that. But right now, we've been able to do that so far. To date, we've done over 86,000 tests. Last week, our test positivity rate was at 27.8%, which is extremely high. Just a FYI that it is community spread, and obviously if you're sitting at a table with 4 people, one of you statistically has it. So make sure that you're aware of that. And we continue to do our contact tracing and case monitoring. As far as medications go, for people who are positive, we do have some medicaments that we're using, which is the remdesivir. That's a hospital, requires hospital infusion. We've treated over 400 patients with remdesivir. We have a monoclonal antibody called bamlanivimab. We've treated over 350 patients with that medication. It is an infusion also. It's an outpatient. And it is, both those things require certain criteria to be able to receive those medications. And so our ID team is working very hard to look through those that are positive each day and offer that medication to the ones that qualify for it. We also are part of, as I mentioned last month, part of a clinical trial with Gilead to use remdesivir in an outpatient setting, not in the hospital. And so we continue to work through that. We've exceeded our number that Gilead had requested to be part of the study that we would initiate into the study, and we've exceeded that number and continue to have patients sign up to participate in that. So Dr. Mara and his group are doing a fantastic job at keeping those clinics going. We have vaccine clinic, and that seems to be the thing that we get the most questions on right now. And obviously, you guys probably have some questions when I finish, but hopefully I can answer some of them before you ask them. We started our initiative as soon as we received our vaccine. We get vaccine each week. We don't know for sure until a day or two before how much we're going to get. We are scheduling appointments for those to receive the vaccine and to make sure we don't outrun our allocation. And so as our allocation comes in, we get those patients, we get those people pulled in off of our list to get them scheduled. We are in the phase 1B, which is 65 and older. We have identified just in our system that we have over 27,000 patients that are over the age of 65 that are just in the people who use our system. So we'll be in this phase for a little while. That doesn't mean that just those patients are eligible for the vaccine. As George said earlier, anybody that is a beneficiary is eligible. for that vaccine. So we've been pushing out the number to call and get an appointment if you so choose to receive the vaccine. And we have 30 staff that are allocated to answering the phone lines and getting people scheduled. And obviously, as that schedule fills up, we don't open up the next days until we have the vaccine in our hands to allocate for those days to administer it. The numbers on the vaccine that we're receiving are a little bit hard to decipher because we do receive the second dose also, and we have to hold the second dose back till it's time for that second dose, that person to receive the second dose. We do have a question came to me about Moderna vaccine because we had finished our allocation of Moderna as of last week, and if we were going to have enough vaccine for their second dose, and the answer to that is yes. We will be allocated the second dose for Moderna. We haven't received that yet, but we will receive it in time for us to administer that second dose to those patients that got the first dose. There is a little bit of technical criteria to handling those vaccines. They're a little different. Each one of them have a different EUA, and each one of them are handled a little differently from our pharmacies. So we're being very cautious not to waste a dose and make sure that we get every dose we get allocated into the arm of a recipient. And we have mirrored the CDC recommendations to continue to follow the phases as we move forward. Currently, we've got enough vaccine. We're kind of bumping up against our allocation. We've got to a point where we have more demand than we have supply, and we're working hard to try to get more vaccine. We're in contact with IHS weekly and almost daily. As soon as they have allocation, they let us know, and then we open up our schedule to get more folks scheduled to receive the vaccine. So anybody that would like to see how our vaccine clinic that hasn't used us to get their vaccine or to this date, or would like to see how our vaccine clinic is operating, please contact me and I'll be glad to have you come in and we'll give you a little tour of how it works, because it is completely different than a flu vaccine in the reporting, the observation, and the administration of the vaccine. Currently, we've administered well over 4,200 vaccines, and we have people already scheduled for their second doses, and we are continuing to again schedule primary doses as soon as we receive them. The last thing I want to report on is our hospital. We've entered our second phase of our surge plan. The first phase, we opened up more ICU beds and more labor and delivery beds. As we talked about at least, I think, 2 meetings ago, we've hit record numbers in our labor and delivery department. So because of that, we've had to expand that area to keep those mothers and children safe. So we've entered our second phase, and that's opening up more beds for our med surge area. We just got our med gas lines finished this weekend and certified, and we started staffing those beds today. So we should get those opened up as early as this evening or first thing tomorrow. So it's always a little bit of a challenge to find areas to put beds in, which we have that space to do that. The bigger challenge is finding the staff to man those beds once we get them certified. So those are things that we're working on constantly, and I'd be remiss if I didn't brag on our team. Our team has worked tirelessly throughout this whole pandemic. Proud to be a part of our team. Any challenge that we've been brought before us, we've worked together, and they have worked extremely hard to come up with solutions. And just want to make sure that I acknowledge our health team on everything they're doing to keep our systems moving forward and not let any of our systems fall off to where we have to deny services to anyone. So in addition to all the COVID things that are going on, of course, we also have all the other disease processes that are still out there that we're still dealing with, and we want to make sure that we're here for our citizens as they need us. The last thing I might mention is I sent a memo to Speaker Byrd and to Chief this morning with my recommendation to get those that are in the Cherokee Nation government and essential to keeping our governmental process moving forward, to get them vaccinated. So if that is the desire of Speaker Byrd and Chief Hoskin, then I would encourage them to work, Speaker Byrd to work through a process or get a hold of me, and we can work through a process to allow that to happen and to make sure that we keep our continuity of government moving forward. This pandemic is obviously, we're in a surge. It's gotten to a point where, as I said earlier, we're at 27.4% positivity rate, and the hospital beds are full. Anything that we can do to make sure that our essential services stay open and that the government continues to work and help us as a health system continue to work by allowing us to helping us to meet those needs is essential at this point. So I would encourage us to move forward on that with that decision in their hands, obviously. So with that, I'll stop and let you guys ask questions, and feel free to ask whatever. We'll try to get you an answer. I've got Dr. Montgomery on the line with us in case there's any technical answer or questions about the vaccines themselves.
Questions for Dr. Jones? Sean?
Hey, Doctor. First of all, thank you and your staff. You took a call from me yesterday on a Sunday, and I sure appreciate that. Is there a percentage of the positive cases that end up being hospitalized and the ones that, just kind of watch it at home? Is there kind of a breakdown of that within our facilities?
I don't know that we have a breakdown of that. I can let Dr. Montgomery answer if you'd like. We don't have a breakdown. Everybody reacts to the virus differently. Of course, there is evidence that shows if you're in certain comorbidities or you're in certain age or things of that nature that you may be more prone to have a hospitalization versus a young person that's healthy. But we have seen outliers in all that. We've seen people of all ages be hospitalized with this, so it's not something that you can just quantify like that. And I don't know that we have a breakdown. We do know that administering the remdesivir and the bamlanivimab has shown an impact on keeping people out of the hospital and out of the urgent or ER area. And that's just been a study that we've been doing internally, anecdotally, just for our own purposes, to see what percentage of those patients that receive that medication end up going to the ER, or being admitted to the hospital. And we've definitely seen a reduction in hospitalizations due to that medication. So we're working hard every day to make sure we keep getting a bigger allocation of that. It's not available on the free market. We do get it from the Indian Health Service. So we were allocated 50 doses, got 500 doses to start with, and 50 doses a week. The last week we were able to get 150 doses. So Admiral Watts and his team are working hard with us to make sure that we are getting what we need to continue to offer that to our patients.
Right. I'd hope we'd be able to say most are not hospitalized, and it'd be neat to see a number if that was something you could come up with. Also, the call we had yesterday, like I say, I appreciate it. Now, just to let this body know, and you might know it already, a constituent of mine got back a test, and he showed it to me. It just said detected on there. And is that the way all of them do, Doctor, or is that do some of them just on their portal? Do they most of the time say positive or negative, or was that something kind of uncommon or common?
My understanding, that's pretty common when it comes from the lab, that it says it's detected or not detected, and then down below it had another sentence that basically had in parentheses not detected, and so just for everybody's information, that other area down below is reference to the control that's used to run that test. So they want to make sure that the control is accurate before they give a positive or negative result. And detected means, yes, they detected that the virus is there. Non-detected is a negative test, which means there's no virus detected in that specimen.
They got to look at that top. They got to look at that top sentence there on detected,
Yeah,
and just
it's typically bold and bigger, and so that's what draws your eyes directly to it. And it's usually the first thing. The thing underneath is just a reference to the control.
And just in case I'm on Jeopardy, though, does some of them just flat out say positive or negative, and this one's a little different, or do they all say detected?
Dr. Montgomery, do you want to answer that? Do you have any experience with that?
There are differing results from LabCorp that will say detected and some will say positive. We've asked them about trying to make that a uniform response, but unfortunately there's not been an easy solution with LabCorp to have this all reported the same way. So there are two different results that are positive results, detected and positive.
That answered my question. I appreciate you guys. Thank you.
Dr. Montgomery, are those recovered COVID patients, are we still recommending the vaccine?
It's recommended that they wait, and again, it's preferred that they wait 90 days from the recovery from their infection to get vaccinated. But if a person chooses to get it sooner than that, we are offering the vaccine.
So medically, we are recommending the vaccine, even if they've recovered from coronavirus. Medically, we are making that recommendation.
Yes, the duration of immunity is not established yet, and it's thought that the immunity may wax and wane, but eventually wear off, so to speak. And so the vaccine is recommended to preserve the immunity afforded by the vaccine.
Okay, thank you, Doctor. I had a different subject here. Do we have plans to, I've had Cherokee teachers call me, and I guess the state of Oklahoma has kind of moved them to the front of the line to get the vaccine. Do we have any plans in our system to prioritize our school teachers?
Currently, we do not. We are working through our phases based on age. That is the best way that we could handle the amount of volume that we have, because we don't know week to week what our allocation is, and we can only put so many people into the schedule to meet what allocation we actually have in our hands. We can't anticipate what we have coming forward, even though we do get a phone call saying we think that on 2 days from now you're going to receive this allocation. We have to make sure that allocation gets to us through the supply chain, and it gets to us with the correct monitoring. So when that box comes into our possession, it has a monitoring device on it that has to be called in to make sure the temperature parameters did not exceed or fall below the certain temperature parameters that are required by the vaccine manufacturer. So we want to make sure that we have it and we have it ready to go before we schedule patients. And that way we don't get ahead of it and schedule somebody, then have to call them back and say, I'm sorry, we didn't receive the vaccine, or there was a problem with the supply chain and it's not ready to go. It hasn't been approved. And so that's why we're moving cautiously the way we're moving to avoid having to do that. But no, at this time, we're not stepping outside of our phased approach, just for the mere organizational standpoint and keeping everything, tracking it correctly and making sure our most vulnerable get it first. So it's a long way to answer your question, but at this time, no.
Thank you, Dr. Jones. Councilor Shambaugh.
Hey, Dr. Jones. First, I'd like to tell you thank you. I had a phone call to you late on a Saturday evening, too, and a text, and you returned it, and I appreciate the information. The family appreciate the information that you gave me. I guess my question is, if a family, say the husband's native and the wife is not, and they're both elders, it doesn't sound like we're going to have enough vaccine to vaccinate that non-Cherokee person. Because I've had probably 4 or 5 calls about families wanting to get vaccinated with their spouse, but their spouse either way was not Cherokee. So at this time, I think it would be safe to say that just the Cherokee is getting vaccinated.
Yes, currently we just have an allocation for beneficiaries, and again, we get our allocation from Indian Health Service. The state gets their allocation. The health department gets their allocation from the state of Oklahoma. So that person may be or may not be eligible depending on how the state of Oklahoma is doing it. But currently, it's similar to what we're doing with our other services. That allocation is set aside for beneficiaries, and so that's the rules that we're currently following. We would love to have enough vaccine to administer to every household, and maybe at some point that will open up and we'll be able to be, like we do testing, open it up to all households of beneficiaries. But at this time, we don't have the allocation to do that.
Okay, and you said that we were a little behind. We've vaccinated 4,200. How far are we behind? I mean, how many, do we have an approximation of about how many people are wanting the vaccine and it's not available yet to them?
Well, yeah, I mean, we have a greater demand than we have supply. So if you just took the raw statistics and say we have 27,000 people in our system that currently have a record in our system above the age of 65 and say, 50% of those people want the vaccine, that's 13,500 people wanting the vaccine. And so far, we've been able to administer a little over around 4,500 vaccines. So, we're obviously the supply is not meeting the demand, and that's not unique to us. That's unique, that the whole world, the whole nation is that way. Everybody's seeing those numbers. So we're just working through it as quickly as we can. As soon as we get it in our hands, we get it into the arms of those that are wanting it, that meet those criteria. So it's a nationwide problem.
Yeah, and I'd just like to say thank you, first of all. You guys are, it seems like we're always stepping into territory we've never been before. And you guys are having to deal with things that whoever would have thought we would have to deal with this to try to service our people. You guys are doing a good job, and I know it's difficult, but I also know that you guys are doing the best that you can. And I'd like to say thank you for what you've done. One other thing. I think it is, I brought this up last month about our administration. I think it's very important to keep our administration safe. We need to keep our government going just for these reasons. We need to keep our decision makers safe. You need to be safe. I mean, this is a major deal to keep the Cherokee Nation running, is that we keep our leaders safe, and I applaud you for doing that.
Thank you.
Thank you, sir.
Councilor
Appreciate your
Austin.
support.
Dr. Jones, this is Counselor Austin. Do we have many of our elders who are getting vaccinated either through county health departments or through the Claremore Indian Hospital. When we contact them, when it's their turn through the Cherokee Nation, and we find out, are we asking the question if they've been vaccinated, and if so, are we recording that or keeping track of that in any way so that we know that this person's been served already?
Well, the way our system works is we send out a robocall to all those that meet that criteria that we have record of. So if you're not in our system, you would not have got a robocall giving you the number to call. So at that point, it's on the patient's responsibility or the individual's responsibility to call the number. And we have two different numbers to call. One is a toll-free number and one is a local number that's been put out numerous times. And when they call that number, it routes them into a scheduler who will either get their appointment then, if there's an appointment available, or put them in a queue that we'll be working from the oldest to the youngest to make sure we get our most vulnerable people first. So no, we don't actually call them and say, have you been vaccinated? Do you want an appointment? we've notified them that we've hit their phase, and it's time, that they are eligible now for the vaccine, and then they must call us and get that scheduled. So if they get that vaccine somewhere else, obviously they're not going to call us and get on the list. It is remarkable that we still have people who don't show up for their vaccine appointment. That happens every day. It doesn't happen very often, but we usually have a few doses every day that someone doesn't show up for. And what's so critical about scheduling these appointments is we can only thaw what we're going to use. If you thaw it, once you thaw it out, you must use it. You have a very limited amount of time to use it. So we thaw each day what we need for that day to administer it. And when someone doesn't show up for their appointment, obviously that's potentially a wasted dose. And you have to thaw these things in increments of 5 and 10, depending on the size of the vial or which medication we're talking about. With Moderna, you have to thaw 10 doses at a time. With Pfizer, it's 5 doses at a time. So if we come up at the end of the day and we have 2 or 3 doses that are left over, we have a list that we start working down and calling. We know by, an hour out, we're going to have some doses left over. We try to get people that we know are close by to come in and get that dose, so we don't waste a dose. One of the priorities that we have is not to waste a dose because it is such a supply issue. So it's a little bit difficult to track and plan this ahead of time, so we don't waste any doses.
Just from a data and a statistics standpoint, we really don't have any way to come to terms with what % of our population has actually been protected by the vaccine yet, because of our citizens are eligible in many ways to get the vaccine. So we really won't have good data, will we, on what % of our population has been protected?
Probably not for a year, at least, okay. I would say. And the thing about it is you don't get that protection. We're just now hitting that second booster shot phase. So we started last week. Some of our people that we had administered the primary dose for started getting the booster shot. So now we're into a phase where we have a certain amount of shots we give a day that are primary and a certain amount that are secondary or booster shots. And we have to track all that. So and then after that, according to the research, you're looking at 7 days before you're hitting that immunity phase where the T cell immunity is up to a point that you have some protection. So we're just now getting into that with those that we've administered the vaccine to when we first started this project.
All right, thank you.
Dr. Montgomery and Dr. Jones, I just want to commend the outstanding staff at our vaccination clinic.
I'm sorry, I can't hear.
Dr. Jones, Dr. Montgomery, can you hear me now?
Yeah, we can now, yes.
I want to commend the outstanding staff at our vaccination clinic. They really go above and beyond. They're very courteous. They're very thorough in explaining the pros and cons, and they give you that comforting feeling when you go through the line there. And they're to be commended. They're just they go above and beyond. We're very blessed to have such a medical staff that are so trained. So I want to commend you and Dr. Montgomery for providing these people to us. And I took my second dose last Wednesday. And for the people that are a little bit eerie or heard all these horror stories about the second dose was actually milder with less effects than the first one because of your staff. And I had a lady that she said she worked in a dental clinic, and she said, I'm used to giving shots daily in the mouth. I know where the tender spots were. She's rubbing the alcohol on my arm, and I'm waiting for that. I'm embracing for that shot. I turn around, she's putting a Band-Aid on there. I said, have I already got my shot? She goes, yes. She goes, I know how to give shots. And it was good. So anyway, and then I got calls back that they've been requesting this. I'm not going to say her name. That they've been requesting this person again to come back and give shot. My niece just called me this morning and said that same lady gave me my shot, and I didn't feel a thing. So I don't want to bombard her, but all of your staff, they're doing a great job. Now to our administration. You mentioned that early on about getting them protected. They're out in the front lines, or in our leadership, or most of them probably be cabinet level if they don't fall into that category of 55 and over getting vaccinated. You know, the council members, I'm posing this at you guys. I don't have a problem with our leadership that are out in the front lines getting vaccinated if nobody else is, because it sounds like we have ample vaccination available. Is that correct?
What I'd like to do is once we determine who is interested, who wants to get the vaccine, if you can get that list to Mr. Enlow or to me directly, and then we will work to, like I said earlier, every day we have a few people who don't show up. And if we can work that list in, then we can, you essentially, I think won't be jumping ahead of anybody. You'll be helping us not to waste a dose.
Sure.
And that is the key here, because we have such a supply issue that, if you can help us not to waste a dose, you're helping us as well. And we would be willing to work with you and figure out how we can do that effectively and make sure that it's not, we're not adding to what the staff anticipates, but we're working it in a very effective manner. So
Yes.
just need to let us know how we can help, and we'll be glad to work with you in figuring that out.
If you get that information to me, then what kind of numbers we're talking about here, I would appreciate it.
Yeah, you just, what I just need is a list of everybody that's interested, and then we'll work our way into making sure we meet those needs.
Okay. And a final note, I was contacted a couple of days ago. There's a 96-year-old. She will be the oldest speaker that we have at Cherokee Nation, is going to take her vaccination at the end of the week. So, everybody's stepping up. I really appreciate that, how they're explaining the pros and cons of this vaccine. So, Dr. Jones and Dr. Montgomery, we really appreciate your staff. Thank you.
Thank you.
Thank you,
And-
Mr. Chairman.
If I could make a comment about the Cherokee speakers. So there has been some questions around that. I will say that Howard Payton has worked tirelessly. He has been a blessing to our team to help us work through the list. He has a role of first language speakers, and so he's working with those folks to make sure that we give them priority to get on the list. And every day he gives us a list of names, and we work those names very quickly to get them vaccinated as soon as they are ready to get vaccinated. So he's been a blessing to us, and I think there's been, people have called and said, well, I speak Cherokee and I need to get vaccinated. And so we've been able to refer people to Howard also to increase his list. So it's worked, it's been a positive on both sides for us, but Howard's done a great job, and I just want to I'd be remiss if I didn't mention what a asset he's been to our team.
I've been working with Howard. I give him names almost daily. So in different communities, if you get one family member, you'll get that cluster. So it's worked really well. He's doing a good job. Yes.
He has. Yeah.
Thank you, Mr. Chairman.
Mike?
Real quick, Dr. Jones, it was my understanding there was 3 clinics who were getting vaccines, outlying clinics. Are they still getting the vaccines, those 3 clinics?
No, they pulled back on the allocation a little bit, and I don't know what the breakdown in the supply chain is. So we are pulling back to Veneta and Muskogee currently, and when that supply chain breaks back open where we have more vaccine to administer, we'll start opening back up at Redbird again. But currently, as of this week, our allocation came down from the week before. We were told it had to do with a supply chain that was at the national level, it wasn't at the IHS level, but even above them with Operation Warp Speed, and they're working through those challenges. And as soon as that allocation comes back online, then we'll start at all the clinics again.
Okay, thank you, sir.
Do we have any other questions for Dr. Jones? Junior?
Just down at Sequoia County at the health service, we had a 92-year-old man that got 82-year-old man that got a shot, him and his wife. And then 2 days later, he got a call from Redbird, and he was on his way there, and was in the parking lot. He got confused, and he was going in to get his shot. He thought he was getting his booster or something. I don't know. He was confused. What do you think would have happened if he would have took that second shot that close? Would that have affected him? The first one didn't bother him.
Dr. Montgomery, do you want to speak to that?
It's hard to know, but I think more likely he would have just experienced some mild side effects from getting that second shot a little sooner than expected. But I don't think it would have been, I think it would have been very unlikely to have caused him any serious side effects.
Well, that's good. His daughter caught him in the parking lot and saved it from going in. Thank you.
And I would say that with our checks and balances of having him on record of when he got his first dose, when he would have made it into the building, we would have caught that, and we would have been able to counsel him and get him squared away on when his secondary dose would be.
Dr. Jones, have we had very many employees to leave since we started doing this COVID testing on the outside? Have you noticed any of our employees either quitting or going for different jobs?
Well, there's been a lot of them. You know, we run through our staffing numbers. We actually I get a report every day that shows every clinic what our staffing levels are, what our by different disciplines where our challenges are. This COVID pandemic has driven some people to a point of saying that that we're close to retirement, or to a point where they thought they don't want to continue in this stressful environment, to go ahead and say they were ready to retire. I'm envious of those people that are ready. They're at retirement and ready to retire if they're ready to go, because that is a great thing to get to that point in your life when you have the ability to retire when you desire. However, it does create challenges for us, and we already knew coming into the pandemic, prior to COVID ever starting, that there was a nursing shortage across the nation. More nurses retiring than coming out of school, and we had already stepped up to partnering with Connors State and Northeastern to help shore up a nursing program locally, to get more nurses into our clinicals in our system. So we had already started addressing some of those challenges, but this escalated all those challenges. And so, yes, there are some people that have left our system. I don't know that it's strictly due to testing or strictly due to what the issue might be. It is a challenging, stressful environment to work in. There's no doubt about that. So some people handle the stress better than others, but in healthcare, that's what we do. We deal with it and we move to the next thing. And so I have to commend all those staff that are here and how hard they're working. They're doing a great job every day, and it is challenging because we do have people who get sick and go out, and when someone goes out and you're short staffed, that puts double work on the person sitting next to you. So it's a challenging environment for sure.
Well, I was just wondering about that, because I know all council members here appreciate our healthcare workers, because I know some of them stay there till 6 o'clock, 7 o'clock to make those calls, and they're really appreciated for doing that. So I hope at some point in time that we can recognize them even more further than what we're doing. The other question I had is on our provider vacancy rate, and it says 5%, and doesn't that usually run about 2.5%?
It does, and we have had a little bit of turnover, and some of it is, there's certain times of the year that are more prone to a little turnover than others, because we have, we're moving into that season when residents are leaving and residents are coming on, and those are included in there also. Also, we have, we have people who retire. We have situations where our vacancy rate fluctuates a little bit, and it's just the time of year when those things occur. And like I said earlier, there are a lot of people in healthcare that are retiring currently. There are some opportunities to go out and be in the traveling environment with some of these organizations that are that we even work with to contract locum tenens. So There's a lot of opportunity like that right now, and people are taking advantage of it while the money is good, because they're paying top dollar. And just like us, when we have a need and we have to work with one of those companies to bring that need in, of course, we pay a higher rate for that, and that gets passed on. They're not somebody that's probably going to stay. Very rarely do we get people that come into us and they stay with us a long term. So we use that as a tool to fill in the gaps when we have someone that retires, or a resident that moves on, or what have you. So the situations are always changing in that environment. But if you look at it on a national level at 5%, we're still way, way, way below what other healthcare systems are experiencing right now.
Yes, and can you, about what is the number between a 2.5% vacancy rate and a 5%? How many people are we talking about?
I don't know that off the top of my head. I would have to get that back to you and let you know, because our recruitment report, sometimes they just include medical, and sometimes they include all providers, which would be dental, optometry, and physical therapy. And so I'd have to look at that for sure and see exactly what she has in that number.
Okay, all right, well, you guys are doing a good job, Doctor, so we all appreciate you. Thank you.
Welcome.
Chief of Staff, did you have speak?
Yes, sir, if I might. You know, one of the things I really like about Dr. Jones is that he is very process-driven, and he just described our testing, our vaccination process, and it doesn't sound that difficult. But if you really dig into the nuts and bolts of what's going on behind the scenes and the coordination of 2,600 employees across multiple sites, across multiple shifts, running a hospital, it's a pretty amazing feat that our team goes through every day, not only for testing, but also for vaccination, and knowing which vaccine they received on what date, what facility, making sure we call them back and we get them in the system. And the other thing I'd like to point out too is we talked about Howard and his work hand in hand with the healthcare department. We have about 8 speakers that are answering a call line in case speakers have questions. So far, we've either scheduled or vaccinated 700 of the roughly 2,000 speakers that we're aware of in the roll book. And we've had some call that we're not on the roll book, and we've gotten them in and coordinated that with them. So it's also been a good way. You know, when we started the speakers roll book, we had no idea that this was going to be the basis for us to try and coordinate vaccination and preserving the speakers and the language as much as we possibly can. And I'd like to commend Howard and our healthcare team for coordinating together on that. That's, you know, typically that would be a silo and saying, well, no, this is my world. And they've both worked together very well to make sure that we protect the speakers. And then one other thing I would like to point out is, you know, Dr. Jones talked about the therapies that we're doing, and there's a lot of work that's going on, not only for testing, not only for vaccinations, but also the treatment and therapy inside the facility, the converting multiple rooms, and just the sheer volume, the processes of everything that has taken place for us to roll this out. So as Mr. Vieri pointed out earlier, they had a problem with their phone system. That was one of the things that we did when we rolled out our vaccination plan of trying to connect with those that were 65 and older. Our first tier was to call the 27,000 with a robocall to say, hey, please call us if you're interested in receiving a vaccine, so that we could test our phone system and make sure that that process didn't fail. And we reallocated phone lines. So this is a coordination effort with IT and our cell phone, our phone providers. And so there's a lot of moving parts behind the scenes, and I just really want you guys to appreciate it. As he described it, it doesn't sound that difficult, but in the background there is a lot of work going on by not only the health team, but IT and our speakers and language departments of trying to coordinate and keep this ball moving forward. And so I just want to recognize it. Everybody's working together on this one, and it's a lot of work going on to make sure that that phone system doesn't fail. We want to make sure that we lived up to it. And then the other thing is, I'd like to point out that, you know, everything that we're doing for the vaccination is methodical, and we're making sure that we don't get too far out over the tips of our skis. And we don't want to set an unrealistic expectation for people. So, for example, I saw in the news that one of the states had done a drive-through vaccination event, and they had 700 vaccines, and they had over 20,000 people in line. And so we don't want to do that. We want to be realistic and coordinate that. And so I think the health team has coordinated a good plan, and obviously our hope is that the supply increases, and therefore we can increase our volume. And so Dr. Jones and team have developed a very good system. It's scalable. And so once we get more vaccine, we should be able to push it out quicker and get as many people vaccinated as we possibly can. Thank you, sir.
Any others? In closing, Dr. Jones, we've vaccinated 4,200. Have we had any anaphylactic responses to any of those 4,200 that you know of?
No, we haven't had any issues. I think we had one issue with syncope at one of the vaccination sites, but you typically can get that when someone sees a needle or, that's just normal. So, but other than that, no, we haven't had anything. And we are encouraging everyone to sign up for the Be Safe app that we give that information out to anybody that gets the vaccine. And once you sign up on that, you'll get a daily text, and they will ask you any kind of question. They'll ask you a series of questions. It doesn't take but maybe 30 seconds to answer them, and it tracks your progress as you go forward. And so it's another way of just keeping in touch with everyone as they receive the vaccine, if there's any side effects associated with it. But to date, we've had a little soreness in your arm. That's been about the extent of it. I think there's been a few people that have felt a little bit off the next day, a little bit under the weather, so to speak, or just a little lethargic. But for the most part, a little soreness in your arm, about like what you received with the flu shot.
Well, words can't express our appreciation for you, Dr. Jones, but we'll try anyway. Great big thank you.
Thank you.
Any other questions for Dr. Jones? Thank you.
Mr. Chair, if I could, I'm sorry, I forgot to mention something. I don't want to share any names or departments, but I will tell you that we lost a Cherokee Nation employee due to COVID this morning. We're waiting on the family's permission to share information, but I will say that we did lose an employee. She checked into ICU on Friday and went on the ventilator, and we lost her this morning. So if you would please say a prayer and keep that family in their thoughts, as well as the coworkers that they work with. They're pretty devastated by this, that they lost her that quickly. So thank you.
Any announcements? Our next meeting tentatively scheduled Monday, February 15th at 1. I would entertain a motion to adjourn. A second? Oh, okay. Adjourn.